Hi, good morning, good afternoon, good evening, whatever time
And
it is
good
where
night.
you're
Isn't that a
listening from.
film?
Yeah, that's I
Truman
think it is
Show, isn't that what they
Charmaine. I think
say?
you're right. Welcome to episode 5 of Pooh to Play. This episode, When Pooh Gets Stuck, Feelings Can Too. My name is Sam. I am a researcher and consultant in children's and families' welfare, well-being, and play. And I'm here today with my gorgeous co-host, Charmaine.
Hi, I'm Charmaine Champ, and I'm a continence sleep and understanding emotions consultant here at Clear Steps Consultancy. So I help children with and without a diagnosis. So our neurodivergent and neurotypical children with anything to do with their toileting, sleep, and understanding those behaviour and emotions. That's me.
Amazing. Thank you. And I think that's so relevant to today's episode as well, isn't it? So what a wonderful introduction from Charmaine and how what she does can really support children that are and families that are going through that sort of poo being stuck journey or constipation, and how that impacts feelings. So constipation can sound like quite a straightforward physical issue on the surface. People can think it simply means that a child has not been able to go to the toilet for a few days.
Yep.
But as we've already sort of started to explore in some of our previous episodes during this podcast, it's actually much more complicated than that, isn't it? It can affect comfort, sleep, appetite, energy, concentration, confidence, play, of course, relationships and emotional well-being, and shape how the child moves through their whole day. And when a child can't express or explain what is happening inside their body, adults may only notice the changes in the behavior, and that's what we've explored so far, isn't it? So, Charmaine, constipation can be so much more than not being able to poo, can't it?
Yeah, and so often, like you said, so often people just think it's, when a child doesn't go for a poo. So if they don't go for X amount of days or
Mhm.
X amount of weeks sometimes, although I have worked with families where it's been X amount of months as well. But
Mhm.
constipation isn't just about not going. Constipation's also about the types of poo,
Mhm.
the size of poo, and how often. So it's sort of like it's three things rather than just not going. And I think if we understand that it is like the type according to the Bristol Stool chart,
Have you
and
got your chart,
oh, I have,
Charmaine?
yes,
I think we had
here
an episode,
I'm
didn't we,
showing
where this
poos.
had a
Just pre-warn you,
great
pre-warn
feature.
you.
Here is the chart,
Yeah, the
which we
Bristol
love.
Stool chart. So yeah, so we are looking at our type 4 poo according to the Bristol stool chart, and we're looking to pass that either 3 times a day or 3 or 4 times a week. And if we're not passing that at those times, that's what we're saying. Is it the fact that our poo has got stuck inside the body? So if we're looking at any of our 1, 2, or 3 poos, or even if we're looking at our looser type poos, it can be that there's a poo inside and then there's a looser poo coming out. So when we're looking at constipation, we're looking at the type. So are they passing a type 4 medium poo according to the Bristol stool chart, 3 times a day or 3 to 4 times a week? Or, you know, are they passing large or extra large poos? Because the only way they can pass a large or an extra large poo is if there's a build-up, and that could be a build-up in the rectum or the large bowel. So you can see can see my large bowel in the background. That really doesn't sound quite right, does it? I mean the apron large bowel. But
It's a
yeah, so
model.
that's what
It's
it is.
not actually Charmaine's large
No,
bowel that we've
no,
taken
mine
out
it's
to
all
put
intact. It's all fine.
there.
Oh, but yeah, so it impacts in so many different ways.
Mm.
So you were talking earlier about sort of what else we might sort of see. So obviously we're looking at the constipation, but what what else might we see, or what that might impact what, when we're thinking about behavior, that type of thing.
Mm. So we might see a child who suddenly becomes much more emotional than usual, which I can totally understand because if I'm not able to go to the loo for whatever reason, it's makes us feel agitated, aggravated, uncomfortable. They might become irritable, tearful, angry. We talked in our last episode about or recently even about, meltdowns, because we might actually, or the children, should we say, I'm definitely not saying I'm like this at all, honestly. Become less tolerant of the noise or demands, struggle to concentrate, just generally not feeling like themselves as well, which, as adults, when we don't feel great,
Yeah,
we show those emotions ourselves as well. And for some children, though, the change may be really, really visible. They may shout or, lash out. They might refuse to cooperate, potentially become sort of like distressed when they're asked to do something. But for others, those signs much might be more quieter and inward, so they might withdraw into themselves or stop engaging in play, avoid social situations altogether, or they might appear to be becoming more unusually tired, or seem to sort of like lose interest in things that they normally enjoy to do.
yeah,
And as adults, we can easily see those changes as behavioural.
because it's what we see on the outside, isn't it? Yeah,
Exactly.
yeah.
Particularly when the child cannot tell us what's wrong. So that's just what we see. And I think
And
it's
completely
important.
natural. So I suppose that's something
Yeah.
to mention, isn't that? Because if you're sort of listening to this and you sort of think, well, I would just, that's what I see and that's what I'm reacting to. That's completely natural
Yeah,
to do that.
absolutely.
No judgment here.
No, it really is. And,
Yeah,
and behavior, it can really be a sign of the discomfort we can't see. Children, don't always have that sort of awareness that we do to recognize what's happening inside their body. They may know that something feels off or something feels wrong. Um,
because
but
like
they
when we're sort of when we're saying about like with constipation, and if you're thinking about sort of poo building up inside,
Mm.
and we're thinking about, we said before about that gut brain connection. And I don't know, I don't know if you can see this, but we always say it's sort of what's happening in here can directly, I can't go that. I'm gonna have to look at it. I'm just going all over the place. I can't see. But what's sort of happening in here is can directly influence our
Mm.
children's thoughts and feelings. Equally, our
Yeah,
children's thoughts and feelings can influence what's
yeah,
happening in the gut as well. But that's what we're looking at, isn't it? When
yeah.
we're talking about that, we're talking about that gut brain connection. Because if we're thinking about that poo built up, because sometimes people sort of think, well, there's just a little bit of poo in there. But
Mm.
can I show you another part of a large bowel? Is that okay?
Let's have a look at it. Let's have a look.
So some very
Oh,
kind person knitted a large bowel for me.
I love that.
So you've got like the poo in here, and some people just sort of think, well, there's just poo in there, and then it's going to come out,
Oh,
isn't it?
I like that.
Comes out,
That's fun.
yeah. But what can happen when we're thinking about that constipation is that we're thinking about it's actually built up inside.
Mm,
So when our children are actually going to the toilet, they may still go for a poo, but we've still got poo in here.
mm,
And what's happening in here is that that is actually taking more and more water from the body, which means it's getting drier and harder. And that's why we're having that gut brain connection where we may be seeing or it may be influencing the behavior and our children's thoughts and feelings because there's this build up inside. So it's not, so that's why it's so important to think that not just about how often our children are going, but what the type is. Because as you can see, our children, they can still they can still go for a poo, but you've still got poo in here.
mm. And then our children are living with that discomfort, aren't
Yeah,
they? You
exactly.
know, and as adults, most of us, know how the world feels when we are in pain and exhausted, hungry, feeling unwell, whatever's going on, or
Yeah.
hangry, should I say? I think we brought that on before, haven't we? Our patience becomes shorter, doesn't it? And we struggle to concentrate.
Yeah.
So children are no different, are they, Charmaine?
Yeah.
Except that they may have fewer words or fewer coping strategies.
Yeah. And our
Um,
brain and the brain's still developing, isn't it? So when
yeah.
you think about, and I think that's something that we may sort of mentioned or touched on before, that when we're looking at a situation, we're looking at it with 20, 30, 40 or more years
Mm,
experience, and our brain has developed in that time. We've
yeah.
got lots of new pathways that have developed in our brain. When our children are looking or feeling that situation, their brain is still
Yeah.
developing, and certain parts don't develop until they reach a certain, different milestones.
Mm,
So it means that they're not able to access that information as much. And we've mentioned, I think, within our last episode when we were talking about play and we were talking about the executive function of being able to process information and that sort of thing. And if
mm,
we're thinking about, our children being constipated, that's going to be sending those messages through the nervous system, which is then going to be going up the spine, you know, to our pathways to the brain, then is going to be, the emotional brain is then going to be scanning that, isn't it? It's going to be scanned to see how does the body feel? Is everything okay? Yes, it's looking for that yes or no answers, what we were talking about before.
mm.
But if they're constipated, it's not going to be getting that, and
Yeah.
the body's going to be in protection mode, which means they're not going to be able to get to that thinking side of things, isn't it? It's so you just sort of think it's just poo. It's just
Yeah.
poo. But
And
it
that's it.
really isn't just
So
poo,
much
is it?
more. It's so much more. And I think just before I move on, I'm not even going to give away which number. When you said when we're 20 or 30, 40, or even more, I'm not going to give away at all which number mine starts with. But
Notice I
even
didn't go too high with that. There was a purpose for that.
but even as adults, we still can sometimes not fully grasp what is going on with our bodies, and we still get, and even when we can, we still get frustrated and cross, don't we? Because it just stops what we want to be doing and what we can do.
Yeah,
And
exactly.
just sort of continuing on from what you were saying, though, we often talk about that physical health and emotional well-being sort of as if they're separate subjects,
Yeah.
don't we? And
Well, you have different departments, don't you? Like when you're
yeah,
thinking about sort of like the support you go to get, well, even like within health, you've got, urology, your gastro, you've got,
and it's
yeah, your
whether they're
dietitian, they're
working
all
together.
separate.
Yeah.
And then you got the mental health, it's all separate. It's, yeah,
And I think that that is why the title of this episode actually feels really powerful,
yeah,
because it's like when poo gets stuck, feelings can also get stuck within that
yeah,
experience as well. The fear sort of can become attached to the toilet, can't it? And I know that you've seen this in your role and what you do. Shame can become attached to accidents. Anxiety can become attached to the sensation of needing to go. The child may feel trapped in something that they don't actually fully understand and can't actually feel that they can control
yeah,
either.
yeah. And then when you're sort of thinking about, sort of you said about like sitting on the toilet, but sometimes it's the fact that they have to have
Mm.
like the nappy or the pull up. It
Yeah.
has to be there,
It's their
and
safety.
without that,
Yeah.
it's like I have to have this, and it's not it's not a conscious thing for our children. It's that unconscious thing,
Mm.
and they're not aware that actually it's because of that gut brain connection. Their emotional brain is telling them their body doesn't feel right. And it may not be just inside, it could be, you know, other factors that are coming into there, but something is making their body not feel
Mm.
safe.
Yeah.
And when we
Mm.
sort of talk about safe, which, we're talking about safe inside
Mm,
as well as outside.
absolutely. So, where do we begin then, Charmaine, if we are wondering whether constipation might be affecting how a child is feeling? So,
Yeah.
where
So,
can families begin?
yeah. So I always say, let's start inside. Let's have a look at what our children's poo types are. I'll just show the chart again. So having a little, look, what type of poo is our children passing? Now, with a lot of the families that I support, so often they'll share what's happened that day. So if they're past a poo that day, they'll tell me that day, and they might say, yeah, they're definitely passing a type 4. So you
Mm,
think, that's great. And then you think, well, what size was that? Was it a small, medium, large, or oh my goodness, that's incredibly large for such a small person. What size are we actually looking at? So I always say if you could actually keep a little record, sort of like for 3 to 4 days of just sort of having a little look at what type of poos, because you may be passing type 4s, but there may be some of the other poos in between. There
mm,
may be some soiling.
mm,
Then you may have a type 1 in the morning that we didn't realize. And then we might have type 3 in the afternoon. And the following day, we've got a really large type 4. So just sort of getting that pattern is sort of really good to sort of look at. But also looking at what our children may be eating as well. Some children have their breakfast, their snack, their lunch, their snack, and their evening meal. They're sort of eating regularly.
mm,
But sometimes when there's something happening with the poo, it can be really tricky for our children to eat. So it might be that they're not eating, they're sort of like, no, I don't want breakfast, or they're like pushing it away if they're not
mm,
not speaking. So we need to sort of think about, you know, what's happening with their eating. Are they eating regularly? Thinking about the drinking as well. How often are they drinking? So we're sort of thinking about those sort of patterns and sort of keeping like a little record of that
yeah.
um on the website. We do have like a free download, so you're more than welcome to look at that. But that just sort of keeps a little record of what's going on, but also thinking about their sleep as well, because when our children are going to sleep, it means that the whole body relaxes. That then means that the poo can keep moving round. um, And if our children suddenly start pooing in the night, that can sort of tell us a lot as well. If our children are waking in the night,
Mm,
because what can happen, so I'm going back to my knitted large bowel here, is that the poo can, so if I go that way, so the poo can actually move, so the muscles push that. I don't know if you can see that there. Poo moves that, the muscles move that along. If that poo has been in the body a long time, so it's that poo has got stuck, then that will be a drier poo.
mm,
And that could be uncomfortable, and therefore our children may wake. Lots of other things that are a factor as well, but that could be something we're looking at. So we want to be looking at all of those things. So if we're thinking, is it constipation? I'm not sure. Let's have a little look, patterns first, what's happening inside with all those, eating, drinking, the toileting, what's going on with the wheeze as well. Because
mm,
again, if there's that build up, it means that poo could actually push on the bladder. Maybe the
mm,
only sign of that constipation is actually that your child is constantly going for a wee. Or
yeah.
maybe they're having, reoccurring urine infections or things like that. We always need to look, what is happening with that poo?
Yeah.
And that's because, like what we were saying earlier, is around that sort of gut brain connection, because everything is connected. Everything is
100%.
connected.
It's that whole child view, isn't it?
Yeah,
It's so important because it sort of protects us from reducing a child to sort of one label of
yeah,
difficult or anxious, or a child who
Yeah.
soils, or a
There's a
child who
reason.
keeps having
Yeah, there's a
meltdowns.
reason
Yeah.
for it. So rather than, like you say, you know, they're, you know, they're doing this on purpose, or you know, they're just a naughty child, or they're just, oh, they're attention seeking. It's, oh, ugh, I don't like those words, but
Mm.
that's what a lot of people say. Oh, they just want to be with you the whole time. You know, there's a reason why
Yeah.
that actually, yeah, maybe they do want to be with the parent, but maybe that's because their nervous system is not feeling quite right.
And the parent is the safe space during that time. They want to be with
Yeah,
you. Absolutely.
yeah.
100%.
But they might not find the words, mightn't they? They may not, and as we said like
Mm.
earlier, that, our children's brains are still developing. So
Yeah.
they may not have that vast, like some people say, use your words. Well, maybe they can't find the words.
Have the words
They don't,
necessarily.
this
Yeah.
is them, it's their body telling you, this does not feel right. I don't know what
Mhm.
it is, but something doesn't feel right.
Yeah.
You know,
Yeah.
let's
And I
work this
think,
out together
yeah,
type thing, isn't it?
absolutely. And so I think that's why we've got to support the child in the moment as well, And so sometimes I think that next time we see our child, or we see those experiences of sort of that emotional or more withdrawn than they might normally be, I think that we need to make sure that we don't just make an assumption that it's just a behavior.
Yep.
Actually, in that moment, we might begin to think about, well, what's actually happening? There's fewer words for them to show, but we can, acknowledge what we're able to
Yeah.
see without forcing our child to use those words that they don't know. You know,
Yeah.
we could actually acknowledge the children by saying things like, "You don't seem yourself today," or something like, "It looks like things feel really hard right now," not necessarily the
Yeah.
poo, but you
No
know,
pun intended there.
but the idea is that we're acknowledging, and we can check for those basic needs gently. Are they hungry? Are they thirsty? Do they need the toilet? Are they in pain? Are they tired? Is the environment too busy, too noisy? All of these things, and are the
It's almost
demands
like
a bit
having that mental sort
overwhelming?
of checklist, isn't it?
That's
Yeah.
it. That's
It's
it.
almost like in your
Absolutely.
head, so are they hungry? Oh no, they're due to have something to eat. Right, snack. Okay.
Yeah.
Are they thirsty? No, they haven't had a drink for a while. Right, yeah, let's
Yeah.
do that.
Yeah.
So it's
Exactly.
almost like sort of, obviously it's tricky to sort of hold that sometimes, so you might want to just sort of jot it down. But it's just sort of having it, even if you just got it in your pocket, just,
Yeah.
okay, this is what we need to
100%.
look at.
Mhm.
But it's just looking at what is that child feeling in that moment.
Yeah.
You know, like you say,
Exactly.
it's not the behavior, it's they're telling us something.
Because understanding, although it doesn't necessarily remove the challenge, it can sort of change how we're going to meet that challenge, that, and how we're going to support the child going forward, because we've developed that own understanding. Because what have we done in that moment, Charmaine? We have been curious,
Yeah,
haven't we? And
definitely.
that's
Because
just
yeah,
something I think that,
yeah,
to every member of our audience, I think that the best thing that we can say is just remain curious at all times. And I know we say this in every episode. So for people just discovering us now in episode 5,
yeah,
we say stay curious a lot. And
yeah,
people who have been with us since the beginning, it's our mantra, isn't it?
yeah,
It's stay curious. So
yeah.
yeah.
Because every behavior does have a
Mm.
story, doesn't it?
It really does. It does. And I think that today, so if I could leave families with one message today, because we like to have this sort of like, this is what we would love you to hear from today's
Yeah.
episode. It
It's a
would
little
be
takeaway for
a
us.
little take, that's it, a little takeaway. It would be that you are not imagining, okay, the connection between your child's body and their emotions. All right. So please don't ever feel that it is, imagined. Okay. You're not imagining it. They are connected. You may notice that your child is more distressed when they are constipated, less able to cope when they are feeling uncomfortable, or more anxious when toileting is painful. And those observations really do matter. It
Yeah.
does not mean that every feeling or behavior has a physical cause. That's not
No.
what we're saying at all.
Yeah.
Children are complex beings.
But it's
And
somewhere to
then,
start, isn't it? It's where to start with
exactly,
that, isn't it?
yeah.
It's
And
almost like you sort of, like we said about the checklist, it's having a starting point. It's sort of ruling those things out. And if
mm,
it's not that, that's great. Let's move on to the next bit.
yeah, so keeping those notes and then seeking appropriate advice if necessary. Communicate with the adults involved with your child's care, so that you can continue to help them build a picture as well, so that those people don't see those
Yeah.
snapshots in isolation as well. But most of all, remember that the child in front of you is not, you know, most of the time, purposefully trying to give you a hard time. um, most of the time. They may just be having a hard time themselves, and their behavior may be one of the only ways that they can show you.
Yeah. Lovely.
Because sometimes, when poo gets stuck, feelings can too.
Yeah.
Yeah.
Yeah. That's how it all connected, isn't it?
Mm,
All
yeah.
connected.
Yeah.
Yeah.
So from poo to play,
We're here to help you understand what
what might be
might be
happening
happening
beneath
beneath
the
the
surface?
surface.
And I think we've almost nailed it now, haven't
Almost,
we?
almost.
Almost. It's so close. And for those who've just joined, you've got to have you've got to get your betting cards ready, everybody, on when we're going to perfect that final line together. But yeah, I think it just means a lot, doesn't it?
Yeah,
The
definitely.
message that we're trying to put out there. Just stay curious with your children. But yeah. Right. Thank you so much, Charmaine. A pleasure
Thank
as
you. Thank
always.
you as well.
Amazing discussions. And I hope we're bringing so much value to our audience as well, and to parents and carers listening. With changing the sort of the thought process around their children's behavior, and the signals that are coming out. So
Yeah,
yeah. Okay.
lovely.
Well,
Thank you again.
thank you and cheers.
I'll speak to you soon.